You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Singh. Dr. Singh, welcome to the program.
Well, thank you, Randy. It's a pleasure.
Now, before we get into today's topic, tell me a little bit about your practice.
Well, Randy, we're a practice in the Chicagoland area. We specialize in periodontal therapy and dental implants. We have a board-certified anesthesiologist on staff. We work with the majority of the insurance carriers, dental insurance carriers, and our sole goal is to give our patients the best quality care possible.
Now, anticipating this interview, research on you, spoke to two of, I guess, the biggest dental implant manufacturers in the world. They said, this Dr. Singh is the premier provider, and I'm quoting them exactly.
Okay.
Probably one of the best guys at dental implants in the world, another said. So
yeah, those are humbling remarks, and they're greatly appreciated. You know, we just like I said, the purpose of our practice is to offer our patients the best care possible. We see lots of patients. We're growing.
You teach other doctors, right? Is that right?
I've lectured throughout the country. We do a lot of lectures in the Chicagoland area where we educate doctors on cosmetic periodontal surgeries and a lot on the newer techniques in dental implant therapy as well.
By the way, who is the typical patient? I mean, what are the age ranges? Who's coming in? Men, women, everybody?
Majority of our patients are sent to us through their general dentist. Their general dentist will diagnose them with the problem, whether it being a missing tooth, hopeless teeth, or traditional periodontal disease. And the patients will come see us. Majority of our patients that we see age range from the ages of 15, 16, 17-year-olds, all the way up to 93-year-olds.
Getting dental implants.
Dental implants,
correct. So it's become mainstream now.
It absolutely has.
No more dentures. Is that the future?
No more dentures, no more teeth going in and out of your mouth, no more cutting down healthy natural teeth. Dental implants are the gold standard today for tooth replacement.
Okay, you say that in all areas of dentistry, that you're convinced that the dental implant patient is probably the happiest group of patients.
Absolutely.
Why?
You know, if I've been hugged 100 times, 99 of them have been my dental implant patients. Because, Randy, nothing in life do you use more than your mouth. You use your mouth to talk, to smile, for intimacy, to express emotions, to chew, to taste your foods. I mean, you use it every day, 24 hours a day, 7 days a week. And if we can improve your dentition, your mouth, your teeth, it's something that's going to improve the overall quality of your life. I mean, my dental implant patients are more confident. They look better. They feel younger.
Okay.
They just have a better experience in terms of everyday life.
Let's begin with the different categories of dental implant patients you see.
Well, Randy, there's several categories of implant patients. There's patients who are missing one tooth, who are born without a tooth or lost a tooth due to an accident or trauma or decay. There's patients that are missing several teeth, where they're missing two or more, 2, 3, 4 teeth. There's also patients that are missing all of their teeth. They're traditionally wearing dentures at this time. The biggest category of patients we're seeing now, though, are those patients that have been told there are no other options available to them. Dentures are the only option. So they have the remaining teeth, but their teeth are severely infected and they can't make them any better. But those are the patients that we thrive on seeing, because they're the patients that we can make the biggest difference for. Patients that are missing all of their teeth, or patients that have been told there's no other options available for your teeth that you do have. Because no one wants to go, Randy, into this situation. This denture.
Denture, right.
Yeah,
okay.
Because the problem with this is you can't taste your food, it wiggles and it wobbles, it covers the roof of your mouth, it makes you gag. And these are the patients that we get the greatest satisfaction in our practice on treating, because we can give them something that's going to stay in their mouth for a lifetime. They can bite into apples, they can chew on corn on the cob, they can give a toast at their daughter's wedding or at their grandson's
Is it
communion.
true as little as 2 dental implants?
Yeah,
Snap out,
as few as 2 to 4 dental implants on a lower or upper denture wearer will be able to lock a denture in their mouth. Absolutely. 2, you're going to get, it's going to lock into place. 4, it's not going to move at all. You can bite the bark off a tree.
Okay. Let's start with one tooth.
Okay.
What's traditional dentistry have to offer, and why a dental implant?
There's 3 options today in dentistry that we use to replace teeth.
Okay.
A denture, a bridge. 50%. The studies by the American Dental Societies have shown that 50% of dentures and bridges that are done in the United States today will go bad after 5 to 6 years.
So it's kind of a patchwork.
It's a short-term fix, Randy.
Okay.
Exactly.
Okay. So a dental implant, what? Just
now, a dental implant is the gold standard for tooth replacement, because in one visit we are able now to give you a cosmetic tooth the same day. Here's the situation. If you lose a tooth, or many patients are born without teeth, dental implant's the best option available. Because let me show you a picture right here, Randy. This young girl was born without one of her front teeth, the lateral incisor. At 14 years old, she came to see me after orthodontic treatment, and she was wearing a denture that went in and out of her mouth. Now, you can imagine, if you remember back in the day in high school, it's a very, you're very influenced, and it's a very traumatizing experience to be walking around with the tooth falling in and out of your mouth. This is a young, beautiful girl. Look at this beautiful smile she has after an implant was placed in her mouth.
She could match it up.
She could match it up. One day, with computer-guided software, we were able to place an implant and give her a cosmetic tooth in one day. She went home, didn't even take pain pills.
So a dental implant in one day is what you're saying?
Absolutely.
So when I hear
cosmetic tooth the same day.
But when I hear tooth in a day, that's not an overstatement or an exaggeration?
Absolutely
really?
not. Because with the advances in dental implant science and technology and the advances in computer-guided imaging that we now have available for our patients, we are now able to place implants and give people cosmetic teeth the same day, whether it's one tooth, several teeth, like we can show you here on this picture. This young lady who came to me who had a partial denture to replace several of her teeth in the back in front of her mouth. She hated it. She hated the metal wire. She couldn't talk. She couldn't speak. She was a public speaker. She was a high-ranking executive at a large Fortune 500 company, and she hated giving presentations. She felt like she couldn't talk. So in one day, we were able to place implants, give her teeth the same day, cosmetic teeth. She actually went and did a presentation that she had canceled for fear of being sore and having discomfort after the procedure. She went back in and did the presentation 2 days after the procedure was done.
How soon can you eat, by the way, after these?
Same day.
Sounds very painful, though.
You know, Randy, that's the biggest misconception. Biggest misconception that we have. Actually, people feel less pain because most of my patients come to me with infection in their mouth. The implant procedure, we are now able to remove the infection which is causing pain and insert the implant and the cosmetic tooth. The thing that you have to understand is there's no nerve endings in your jawbone. So as a result, we are able to place implants into a healthy area.
Okay. Now, and of course, for certain people that are really afraid of the dentist, you have sedation.
Correct.
Available.
Now, for those patients that are absolutely phobic of the dentist, we are one of the few specialty practices in the state of Illinois that has a board-certified anesthesiologist on staff. What that means, Randy, is I'm good at the dental implant procedures, I'm good at the surgical therapy, but I'm not a jack of all trades. I have a board-certified medical anesthesiologist on staff to offer our patients the utmost in care when it comes to sedation needs, to make them the most comfortable.
Okay, moving down the line, okay, so one tooth, of course, missing 3 or 4 teeth, and then you say there's a group of people that they've been told their teeth have to go.
They've got teeth that are wiggling, they've got teeth that are wobbling in their mouth, causing them pain.
Is that periodontal disease?
That is,
I mean, is that what's
once
going on?
again, we mentioned before, periodontal disease is the leading cause of tooth loss in the world today. Now, when you have this infection, not only is it a problem causing pain in your mouth, but it's also a systemic problem. What I mean by that is the bacteria that's in your mouth gets into the blood vessels and can infect your heart. It can cause respiratory problems, diabetic issues where your blood sugar shoots up.
So you say it's an infection. Okay, so when somebody has gum disease.
Yes.
Okay. I mean, it's an infection.
Yeah, it is an infection.
So at the tooth root?
The infection is in the gum and in the bone that holds your tooth in place. So when you have this infection, it's going to cause bleeding. It's going to cause your teeth to feel loose. It's going to cause bad breath because that bacteria that's in your mouth is releasing acids that are causing the bad breath, causing the bleeding gums.
So when you remove the teeth,
so the
infection goes away.
Yeah, with the implant therapy, we are now able to remove the infected teeth, clean out the remaining infections in the bone, and give the patient teeth, cosmetic teeth, the same day. Let me show you an example here, Randy.
Okay.
Here's a woman that came to our office who was suffering from periodontal disease, anesthetic smile, and sensitivity to hot and cold, inability to chew, inability to talk, embarrassment in talking to others.
When they chew?
Yeah, because their teeth are loose, there's infection in the mouth, and when you chew on an infected tooth, it wiggles around and it causes pain. So she was unable to eat, she was unable to talk, she was unable to smile. We were able in one visit to get this infection out of her mouth and insert dental implants and give her cosmetic teeth the same day. Look at the difference in her smile, Randy.
Very nice.
She couldn't even smile because it hurt her to smile.
You say that some people you have to really talk them into smiling on the before, on the consult.
Absolutely.
And you're a dentist. I mean, really, they don't want to smile?
Randy, the first thing you look at when you meet somebody, when you talk to someone, is their mouth. It's the number one.
Well, you're a dentist, of course.
But you know what? It's true. When you're talking to someone, you're looking at their mouth.
Okay.
This patient was embarrassed of her mouth. She didn't know how to smile. She forced to smile because she was afraid. So, Randy, with this woman, we gave her options. We offered her 2 implants or 4 implants for teeth that would snap in and snap out.
This was upper.
Upper, correct.
Okay.
We then offered her Another option where we placed 6 implants and gave her teeth that were permanently in her mouth.
So fixed.
So fixed teeth that were permanently in her mouth that did not come out. She chose for the gold standard option, which was the 6 implants and teeth the same day, that cosmetic teeth the same day that didn't come out. She was then able to bite into apples.
How soon could she eat, though? Okay, so she goes
She's
in.
eating the same day. She's got to get used to them.
Really?
Same day.
Soft
she's eating
food, though, right?
You know, Randy, realistically, it's something new. So the first couple days she was chewing with softer foods, but within a couple of weeks she was biting into corn on the cob, eating a taffy apple with her granddaughter at a picnic. You know, these are the men and women patients that I see that are the most satisfied because their whole life changes. Not only are they able to eat, not only are they able to talk, intimacy, they feel more comfortable with their loved ones.
Upper jaw, so that's the pain there. I mean, she doesn't complain about pain in this particular case?
She complained about pain before the procedure because, once again, with infection there is pain. When you remove the infection, the pain is gone. Yes, there was some minor discomfort after the procedure with the soft tissue healing and whatnot, but understand, Randy, with the advances today in implant dentistry, patients that were once told that they were too old, they had too much infection, they weren't healthy enough, or they didn't have enough bone. With the advances today in dental implant technology, computer-guided software, and the new medications we now have, we're able to treat these patients and give them something they couldn't have even 3-4 years ago.
So